So dissociative identity disorder is the primary or the A criteria, sometimes I'll refer to that as primary criteria, is when the disruption of identity, again, disruption of identity itself, not really dissimilar to what we're talking about here in fragmentation of identity in the preface section, but that the disruption is specifically characterized by two or more distinct personality states. Now, I put this in bold because I wanted to be clear that that this is how the DSM describes it. So if you ask me, well, what exactly, how do you discern two distinct personality states versus someone with, presenting with a very labile mood? I'm not sure. This is the answer to your question. Part of this is sort of arriving at this yourself. Do you hear distinct personality states? But that is how the DSM captures, defines it. They go on to say that some cultures would describe this as an experience of possession, and, including some facets of our own culture. Again, then that's not meant to be, that doesn't mean that they're wrong. But it just, that can be how they suggest, the DSM suggests that they are, that sometimes these are described as possession, okay? The disruption involves a discontinuous sense of self and sense of agency. Again, how we, talked about in the preface here, sort of a loss of identity, a loss of control, a loss of sense of realness with their surroundings, with themselves. And in the case of dissociative identity disorder, these are observable, or often observable. They can be observed or reported by the individual. But I will tell you, in folks who've carried, that I have worked with that have the diagnosis of dissociative identity disorder, the distinct personality states were observable.